Hi everyone, thank you for watching. So this is quite an interesting one. It's actually the same patient from video 32 where there was the really big wax plug. Now this is their left ear, and actually they had used a cotton bud and pushed the wax quite deep down their ear. I thought I'd share this one because it's a little bit more tricky in terms of removal, so you just have to bear with me in terms of the imagery. I will zoom in a moment, but it starts out just looking like dark impacted wax, and we have a go at trying to just wiggle it and remove it. Quickly realise it needs some oil drops in there, but that's very deep down the ear. You can't quite tell there with this magnification level, and in a moment you'll get a glimmer of the eardrum just up the top, so look out for silvery shiny eardrum in a second, and then that gives you some idea as to just how far down the wax is and where the position of it is. It's about 3 centimeters down the ear, so just see the eardrum there coming into picture, so see the silveriness of it in the sort of top right hand section. There you go, that's quite a good visualization, and the wax just isn't moving at this point. It's basically stuck right on top of the eardrum, and it doesn't look like there's a great deal in there at this moment, and I wasn't thinking there'd be quite as much as there was when it came out, so it's interesting to see how much actually comes out of their ear, and this again would be likely to be impacting their hearing levels. I've just fast forwarded here, so I've used some oil drops. We're just having a chat there as the oil is working its magic. I've just increased my magnification level there, so going back in you can see the glistening of the oil. It gets sucked up there by the microsuction, and we're just trying to grab onto that wax, so it is now starting to move, which is good. Again, you get a good view of the eardrum there. I've just switched back on the magnification and then just zooming in here, so we're grabbing hold of it, so I have to be quite delicate here, obviously making sure to grab hold of the wax. We don't want to go near the eardrum, so we don't want to cause any pain, discomfort, injury, etc. So we're just concentrating on that wax on the left hand side, so it's pretty much half of the eardrum there, look, is just wax, and again in a moment you'll see it start to dislodge and bring it out towards the ear canal, so it will temporarily sort of block off all of his ear, so you'll lose sight of the eardrum. So you can see now we're moving it more towards towards the outer part of the ear, and the eardrum has disappeared. Sometimes at this point patients will often remark that actually their hearing has suddenly gone blocked off again, and they're a bit confused, just as we've lost the gap for sound to travel down. But we just reassure them as the wax comes out, and you can see the focus is changing there, and I'm just going to refocus the image, and here it comes out. But look at that, that's pretty big. That was right down at the bottom of their ear canal on the eardrum, so they will feel a hell of a lot better once that has come out. And we'll just go back in, have another look in the ear. This time you'll get a full view of the eardrum, so the eardrum looks pretty good. It's ever so slightly red and flush just in the top left hand region where the wax was, but all looks good. Thank you for watching. I hope you enjoyed.